The best advice that I can give someone who's been diagnosed with heart failure is, number one, watch your salt intake, keep it down to 2 grams a day. So just as a general rule, you want to avoid the things that are very salty. Processed foods, tinned foods, canned foods. Look on the label. You don't want stuff with more than 400 milligrams in salt in it. Watch your fluid intake. The more fluid you've got on board, the harder it is for the heart to pump. We recommend less than 2 liters of fluid a day. That counts all the liquids you're taking. If you're having coffee, that counts. I tell patients to weigh themselves every single day. We like to know what is your baseline weight, because what happens is many patients actually start putting on weight before they get a real decompensation. And we say that if it goes up or down more than 3 pounds, so at 4 pounds, you notify your physician. Exercise regularly, 20 minutes a day of walking. Exercise is very, very important. People sometimes think, well, I shouldn't exercise, I can't exercise, I'm going to hurt my heart. It's not true. You're going to help your heart to do some activity. It's a question of how much can you tolerate. That's why it's so important to have a physician that will tell you what you can safely do. Studies have shown for patients who have heart failure, if you can do 20 minutes a day, 150 minutes a week, is significant improvement. Get yourself down to an ideal body weight. If you've got a lot of body fat, you're asking it to work harder, and you can just think about it as if you're walking up a hill and now you put a sack of potatoes on your back, you're going to get short of breath a lot quicker. Anybody would. But if you've got a weak heart and you think of this body fat, whatever the weight is of that sack of potatoes, that's how much extra your heart has to work. Stop smoking. The biggest problems for the heart, you're pumping against arteries that are stiff or that are narrowed. Smoking makes it worse. And also smoking, of course, affects your lungs. You need the lungs for oxygen to come into your body in the first place. Well, if you're damaging your lungs, you've got 2 problems. You're not getting oxygen because the lungs are damaged, and then your heart's not pumping the oxygen that you do have because it's not pumping and working properly. Make sure that you take your medications as prescribed, and make sure you're seeing a physician or a caregiver that has experience in treating patients with heart failure. We can make a huge difference if you do these things. And so I try to get them committed to thinking about these lifestyle changes. Send them to a nutritionist to talk about sodium. Then we talk about the exercise, send them to cardiac rehab. And I have seen people who truly are better than they ever were because it was the impetus for change.